Okay. And then apart from that, there's something else I'm going to talk about. If you have worked for more than 5 years, you'll get 33 days leave for the year. So the next thing we can talk about is average working hours per week. So in the NHS as well, you are contracted to work for 37.5 hours in a week. So I do 7.5 hours in a day. Some people do about 12 hours or 11.5 hours. So if you're doing long hours, you will be working about, let's say, 3 days in 3 weeks, and then maybe 4 days in a 4th week in a month. So 3 days for 3 weeks. It doesn't mean only 3 days in 3 whole weeks. This week you work 3 long days, next week 3 long shifts, the other week 3 long shifts, and then the 4th week you do 4 shifts. So it covers your 37.5, but you can do overtime and the lot if you want to.
Hi guys, welcome to my channel. You already know the name is Priscilla Kuma, registered nurse, RMBSN. I come from Ghana. I live in the US and I work in New York State as a registered nurse. I'm a nurse and YouTuber. I've been bringing a lot of videos out for you every time, and thank you for my numerous subscribers. Thanks for sharing this video. And I am so grateful to bring somebody back on this show. She's already been on this show. Her name is Becky Setre. She's a UK-based nurse and YouTuber. She and I have at least 3 things in common. We went to Ola Girls back in Ghana, Volta region. We went to University of Ghana School of Nursing. That's number 2. And then number 3, we are all nursing YouTubers on this journey. We've been giving information out for free and people are loving it. So kindly share this video. Today's topic, if you're wondering what we're talking about the difference in UK and US nursing. People are always asking us, where do you think I should go? Should I go to UK? Should I go to US? This video is not in any way coercing anybody to do anything. We are just giving you what we know based on where we live, and we leave the choice up to you to make your own decision. We are here to tell you about what happens in the US and what happens in UK. And we leave the choice to you. If you want to migrate as a nurse, you don't know where to go, and you're wondering, oh, can I get an information from somebody who lives there? We are telling you the story as it is. So watch this video to the end and share with others, and it will benefit somebody. Thank you very much. If you just joined us, you're wondering what is going on here. We're just talking about UK and US as nurses. We are not telling you where to go. We're just telling you what happens and where we live, and we leave it totally up to you to make your decision. And this is Becky Setre. She's a YouTuber from Ghana. She's based in the UK. She's been there over 20 years. I am Priscilla Kuma. I'm also from Ghana. I'm in New York State and as registered nurse as well. So the next thing we're going to talk about is the hours in the US, the working hours for a nurse. And you already mentioned UK, so I'll just tell you about the US. There's some people, you can be hired as anything. There's so many ranks. You can either be a full-time, FT, they always call it, or you are a part-time, or you are a per diem, or you are a float nurse, or you are a contract staff, or you are an agency nurse. Everything is possible in America. So I am a full-time, so I'll talk more about the full-time. Part-time means that you have certain hours to meet, certain hours of requirements. So I think part-time is 20 hours in 2 weeks, something like that. I'm not very sure. And per diem means that you go on your own terms. Some people call it PRN, as needed. So you feel like, oh, I'll go one week here or 1 day here, and I'm traveling to another country, another state. You go based on your own terms. So per diem, you don't get any benefits from the hospital. You are not entitled to attend any workshop. Nobody's going to stress you. You just show up there, do your 4 hours, 8 hours, and you are out. The whole 2 months, you might not even show up, but there are some limits that you cannot be gone for that long. I think you have to show up at least once in 2 months for sure. Yeah, so full-time. Full-time, you are either 36 hours a week or 40 hours a week. Yes. So 36 hours, meaning that you're doing 3 12 hours. Yes. Or 40 hours, you can do, that is, I think, 2 12s and 2 8s. 2 12s, 24, 2 8, 16. So 40 hours, you're doing 2 12 hours and 2 8 hours. Yes. And 36 is 3/12, but nobody is going to force you to do the 12 hours. You can choose to do them 8, 8, 8, and 4 somewhere, whatever you do to get your 36 or your 40 hours. Yes. And I do 40 hours, and I do 10 hours a day, 4 times a week. So I go 10 hours for 4 times, that is 40 hours. But in the hospital bedside, you want to go there and do 12 hours and get out. You don't want to spend more time in the hospital. So you want to do the 12 hours and have 4 days off. The 4 days are not continuous. I'm sitting home from Monday to Thursday. No, it can be 1 day off here, 2 days here together, and in a space in between, whatever. But whatever it is, they want you to do your 3/12. So some people do nights only. I forgot about that. There are only night contracts. They are hired as night contracts. They are also hired as weekend staff only. So weekend staff will come in Friday night, Saturday night, Sunday night. The whole weekday, you never see them in the hospital. That's also somebody's job. So if you're working days, weekdays, you never see such a person. The weekend staff comes in Saturday, Sunday. That means that person is only committed to 24 hours and they are done. Yes. So the hours, you choose how to work them. What matters is that you put in the hours that you're hired for on your contract letter. Yes. And we use the swipe, the badge. So as soon as you get into the building, you swipe. Then some places when you go on your break, you swipe for break and swipe in and out for break and swipe at the end of your shift. But where I work, we don't swipe for break. And if you do not take your break, there's an exception login. There's a book you write in that I personally did not take my break on this day at this time because the floor was too busy or the office was too busy, so I didn't take it. And you'll be paid. You are entitled to 30 to 45 minutes break. In the hospital bedside, the break is 30 minutes, and they claim you can do a 15-minute break earlier and do 30 minutes earlier in your 12 hour that you're expected to work. But ideally on the ground, so you are so busy that you can't even get that 15 minutes break. You barely get time to drink water. You barely get time to go even pee. So you just want to take that 30 minutes and eat and come back and finish your work so that you can get out early. But luckily where I am right now, I get 45 minutes straight break. You sit down and take the 45 in my 10-hour shift. Yes. So those are just the hours, and with all the terms, if you're weekend, per diem, contracts, the hours are all over the place.
Yeah. So over here, as you said, we have full-time. So if you are newly recruited in the UK, definitely you're going to be working full-time, which is 37.5 hours, and you do your 12-hour shift and you would have break in between. But as you work and the years pass, you can decide to go part-time. You can do 30 hours, you can do 20 hours, especially if your pocket is good enough and you feel you want to work less hours, why not? There are others who are bank staff as well. So bank staff register it, like it's a pool of nurses who have registered, and they call you when there is a shift or there's a need somewhere. So some people work as bank staff, some people work as agency nurses as well. So it seems slightly similar, isn't it? So the next thing is about education. So if you're in the UK and you have your children with you, nursery, people are entitled to a couple of hours, government-funded hours, but the rest you're paying it. But from, let's say, I'm going to be talking from primary school year 1. So from year 1 to 6th form, education is free. So you don't pay anything for your children's education. When they go to university, it is about 9,200 and something per year. But the kids are, or that's young adults, they're entitled to go for student loan to pay for the tuition fee. And then they have maintenance loan as well they apply for to help them. So that is about the education system here in the UK.
Okay. So I will speak about the ones I know, because as you know, I don't have a kid, so I can't be specific. But the school going age is 5 upwards. So anything 0 to 5, you go to the daycare, or you have a sitter or a nanny or something. And I have a colleague who pays $350 a week. Yes, for $350 for 5 days. So if she pays on Monday and the child falls sick on Tuesday, they're not going to refund your money to you, your Wednesday, Thursday money. No. So imagine $350, 2 weeks, we are paid bi-weekly. So 2 weeks is $700. So a month is $1,400, $1,400. And your paycheck is like, let's say, $2,500, $2,500 or something. So imagine $1,400 is already gone to your childcare. You haven't paid for your car, you haven't paid for your insurance, you haven't paid for so many things. Yes, so childcare is very expensive in the US, and nobody's going to allow you to stay with your child for 1 year. You can decide to stay with your child for 1 year, but you're going to be jobless, homeless, and broke. But if your partner can support the whole family, why not? There are people who are staying home, they are not working, they are just nursing babies. That is the reason why most Africans or most immigrants, when they come in, Asians to do the same. When they come in, the man chooses to work and the woman stays home and raises the kid. If the woman is a minimum wage worker, earning something between $15 to $17 an hour, and the nanny or the school is charging $20, you are running into negative. So what is the point of going taking your child to school, the nanny, daycare, and going to work? You are losing like $3, so you rather stay home. So yeah, it doesn't make sense. They charge more than how much you make. Yes, so there's no point giving. So you keep that, you stay with the child, so the child goes at the school going age. So 5 upwards, you go to school. So the public schools are free from that age 5 all the way to high school. But as soon as you hit college, there's student loans. Almost every American whole school year owns student loans. I know somebody who is 75 and told me he's still paying his student loans. Your student loans will still be there even when you retire at 65, the official retirement age. The schools in America are so expensive. That's what I always put out there to my viewers. If you are coming to work in the US and you haven't gotten your BSN, or if you have some schooling plan, do it where you are at a cheaper rate. Because when you come here, you're going to be working full-time and schooling alongside, and it's expensive. Yeah, so that's basically college you pay for, but there are private schools, even between that age 5 to high school, there are private schools that you can take your child and pay. But if you want them to go to the public schools, they have numbers, number 1, number 2, whatever, you pay for that.
Yeah, so over here we have private schools as well. So if you have money and you want your kids to go to private school, you can, but they are quite expensive. With the school university loan payments as well, they start paying when they start earning about over £25,000 per annum. That is when you start paying your loan off with a bit of interest, and you're paying the loan for about, I think they are to pay for over 30 years. So after 30 years, it's written off. I don't know if it's going to change. So you won't be retired and be paying your student loan. Going back to childcare as well, below school age, which is nursery, it depends on where you live. So certain areas like London, childcare is very expensive. UK is difficult if one person is working because the bills are quite high. So both of you have to work. So, but at the same time, as you said, childcare is what takes a lot of our money. So there have to be some compromises. For some of us, I do day shifts. The husband has to do night shift so that we can share the childcare. Let's say average for outside London, for a child who is under 2 years of age or 2 and below, 25 hours a week, you could be paying about £137 per week. You can count that for the month, and if your child is doing about 50 hours in a week, you would be paying about £263 per week. So if you calculate that for 4 weeks, you will get how much you're going to be paying. And if you're taking a nanny, it's different. If you're using an au pair, it's different. So there are different types of childcare you can use, but each of them come with its own cost. So it's quite difficult. And shall we talk about healthcare, both UK, US? So in the UK, I would say healthcare is free, but not really free because we pay for it. So the tax that we pay is what the government uses to fund education, the social care, and healthcare, and all the lot. So we are paying tax, and your tax is used to fund those. So if I fall sick, I go and see my general practitioner or my doctor. I phone, I make an appointment, although sometimes it's really difficult to get an appointment. But there are other places you can ring 111 for general advice, general healthcare. If it is life-threatening, you ring 999, which is for emergency. If it is heart attack and all that, you ring 999 and you can go to the emergency department and the care is free. If I see my general practitioner and they prescribe a medication for me, I would pay for it. It's about £9 something standard. If you're seen in a hospital and you get medication, your IV fluids and anything, you don't pay for that. Okay, so that's the difference. And apart from that, if you're a new immigrant and you're coming to the UK to live here for more than 6 months and work, you would be paying what they call immigration health surcharge, which is about £624 per annum, and that would cover your healthcare whilst you're here. Students pay about £470 per year when they come to cover their healthcare. During the pandemic, the government did give some concession to immigrant healthcare staff who are coming to the UK. They said they shouldn't pay for that. So I don't know if that has changed, but the UK health system, that is how our healthcare works. Unlike, let's say, back home in Ghana, when I'm sick, I can go to any hospital, I'm paying and all that. But over here, you can't just go to any hospital. To get to the acute hospital, you have to be referred. To get to emergency department, it means it is life and death or very critical illness. You have to go through primary care, which is like your general practitioner. They would assess you, they'll prescribe medication for you, and you pay for your medication. There are some medical conditions that they don't pay for their medication. I believe diabetes is one of those. So that's how it works here.
I'm laughing because I don't even know what to say. Everybody knows American health system, it's something else. It will drain all your money. You are in America and every day you are praying that you don't want to fall sick because you will be broke. So I'm lucky to say that where I work, they offer health insurance. So I'm signed up onto the insurance company. One of the biggest health insurance companies is Excelos. So they are my healthcare provider. When I came in first, I was on another one, United. There are different private healthcare insurances you can buy. And there are some people that are on Medicaid, Medicaid, C-A-I-D at the end, and care, C-A-R-E at the end. I'm sure you've heard of Obamacare before and stuff like that. So the health system, so for you to even qualify for Medicaid, I think you should be 65 and above. And if you are not working and there's a justifiable reason, maybe because of some mental condition or disability, you are not able to work, then Medicaid or Medicaid, depending on the one you qualify for, you apply and they'll be taking care of your bills. But if you're active like you and I who work, you would be paying for all your medications. Insurance will take a little portion of it. I had a surgery some time ago. It was about $20,000 surgery. The insurance paid about what, $14,000. I have $6,000. I'm still paying. I'm not even done paying yet. So the healthcare system is bad. So with what the Excelos insurance that I have at work, you have something they call HSA. You will be taking some portion. You choose how much they take from your salary and put in that your HSA bank for you. So you can choose to pay 100. You can choose to put 200 in that bank and be using it to pay and buy your medications. I think it has a non-taxable something, so they don't tax it or something. So when you used to buy medications, it's a little bit cheaper. And some you have co-pay, where you go for your appointment and you pay something before the doctor sees you. Or you pay the medication is $100, but your co-pay is like $20. So there are different health insurances. All I know is that the health system is so expensive. And depending on whatever you have and whatever deal your company is offering, there are some jobs that don't offer insurance. So you have to go and buy your own insurance from these people. And based on your income as an individual and your income as a household, then there's a bracket, a range where you fall within and before it will qualify you. If I'm applying for some health assistance, I'm not going to get it. I actually apply for some because I have all these medical bills I'm paying. I'm like, I work for you guys. What are you giving me? So I applied and sent me a long letter asking for my husband's pay for most recent four pay stubs, my income, and together as a household, we make over $120,000 a year. So we don't qualify. They want you to be making like 40,000 or something. I'm way off that margin. So we don't qualify for that. So then that means you have to be working hard and using all your money to pay for the health system. I'm sure you've seen insulin is a big topic always on American TV, diabetes and insulin. It's so expensive. The diabetics buy their insulin very expensive. And how many shots can you get from that pen? If your dose is high, one pen cannot even last you for 30 days. And they've been trying to get it subsidized. There's always issues in the news about how to do something about the insulin for diabetics. Everybody has a ton of medical bills. People have so many medical bills. I even just came not too long ago, but my bills keep piling because you go to the doctor's office, something will come up. So talking about the health system, we have urgent care, we have immediate care, we have the hospital. If you step on a nail or you cut your finger right now, you might go to the ER. But if maybe you woke up with a flu, you're coughing, you go to the immediate care or urgent care, you sit down there and they'll attend to you. Mostly they stock those places with NP, nurse practitioners. Sometimes you have a PA, physician assistant. Hardly will you see a GP in an urgent care or immediate care. So the NP, nurse practitioner, or the PA, they manage those places. So if it's beyond them, then they will now call the ER and refer you over there. If you are doing a pre-employment physical before you start a job, the job wants you to do some blood work and do some assessment. They'll listen to your lungs and check whether you're okay. Or if you come in as a new immigrant, you have to make sure they'll go and take all your blood, not all your blood, but you do a bunch of blood tests. You want to make sure you have TB, so they'll do PPD. They'll make sure you want to make sure you have all the immunization, all the vaccinations, rubella, anything you can think of. So such a thing, such pre-employment physical, you do it at the urgent care or immediate care. So they will assess you and send the results to your employer, and the employer will say, oh, your PPD came out positive. So, but we who come from Africa, most of us, our PPDs will come out as positive. When they inject the tuberculin thing under your skin, it will be swollen because we got the shots for TB, so it turns out positive. Then you are telling them this story, they're not going to believe you. They're going to refer you again to a chest X-ray. So the chest X-ray will be a backing report to show that, oh, you don't have any TB, your lungs are clear and all that. Then you can go and start the work. So for physical pre-employment stuff, we do them at urgent care. If you have a diarrhea, flu, you go to the urgent care or immediate care and they attend to you. But you're driving, have a heart attack, you go into the ER. People are airlifted and whatever, ambulance, they take you to the ER, emergency room or ED, emergency department. Then they'll stabilize you and send you to the ward level or floor level. But trust me, before they send you to the floor level, that means you really need help. They try as much as possible to attend to you quickly and send you back home because the hospital is choked. There are so many cases in there waiting to go to nursing home. There are so many Alzheimer's, dementia. People need facilities that are choked. People have been living in nursing facilities for over 20 years, and they are just going to die there. And until somebody dies, there's no space. People are waiting for hospice. Somebody who has said, oh, I'm terminally ill. I don't want any more treatment. I want to go to the hospital. There's a facility to go and die peacefully for a year. And there's home hospice. So somebody can say, we can't afford that. So bring a sick person, we'll bring him home in our room, and a nurse will come and visit. We'll have an IV line, be giving morphine or something to oxygen, and all set up in the house. And the person dies peacefully at home. So the hospitals are packed. So they don't want you to come and join those people. So if it's something they can manage, they manage it at the ER, EG, emergency, urgent care, whatever level, then you get out. But some people come in, like this, able-bodied come in, and after all the assessment, they realize that the home environment is not safe for such a person to go back. So they have a meeting with the family members and say that you are never home, you're working 80 hours, You can't leave your grandmother who has dementia by herself. We advise you to take them to nursing home. Then they will send your grandmother's information to all the nursing homes around. You don't want them to send your grandmother to California. You live in New York. And you don't want a certain mile whereby you cannot travel to visit. You want like a 2-hour drive minimum. And all the ones around are choked. So they'll be waiting until they finally get a space for your grandmother to come in. And some people to have court hearings. There's an issue with guardianship. You have to always be updating your will and always be updating your code status. You are either a full code, that means when you're having an issue, you want them to resuscitate you, CPR, and get you back to life, full code. Or you are either DNR or DNI, do not resuscitate or do not intubate. You want to be updating those things. You have a healthcare proxy. You want to have a current one so that when something happens to you, you know what to do. But in that case, some people don't have any of that. So they come to the hospital and there's no healthcare proxy, and they have, excuse me to say, have lost their mind and they cannot make good judgment decisions. So now they have to go to court and fight for guardianship and who will be the healthcare proxy to make decisions for you because you did not put anything down. So such a person will stay in the hospital. They keep adjourning the case. I had a patient who stayed with us for over 8 months. They go to court today, they adjourn the case, come in 2 months' time, and all that. So before they finally decide a full guardianship, then they will now find a place to send that person. Yes. And there's some other family issues, and this person wants to be the proxy, so she go and challenge the court that when the person was saying, they said, I'm the first child, but he did not mention your name on the paper. He does. So there are other issues that are keeping people in the hospital, and the doctors don't have time for you when you go to the doctor's office. First 15 minutes, they will need to get out. Anytime you start eating it beyond 15 minutes, the time starts going and your bill is going to be too much. So your goal is to avoid the hospital. That's why immigrants don't like going to the hospital, because it's expensive.
It's expensive, yeah.
The undocumented people who are here sort of illegal, don't have papers, choose to die at home because they cannot go to the hospital. They'll figure them out, they'll report them, and a whole lot. So the healthcare system is the cashing out cow system for America. They rely on it. They make so much money from it.
Yeah.
And, yeah.
There are lots of similarities, like when you're having a heart attack or something serious at home, you can ring 999, the ambulance would come out and pick you and take you to hospital, and you don't pay for that care. And if you need care, you need monitoring. Then when you get to A&E, they would move you to a ward and all that. There's quite a lot of similarities, but the difference is that we don't pay, or we don't do the insurance system. We pay our taxes. People also pay insurance for private healthcare if they want to go to private hospitals. There are private hospitals in the UK as well, but the general population, if I can't afford private care, I go to the National Health Service, which is the NHS, where you don't pay anything for your care. Yeah.
Let me just add 2 things. For the ambulance, I thought it was free. I was very sick. I thought I was going to lose my life. I shared that on my video when I talk about my endometriosis journey. I told my husband, I don't have time for you to drive. Just call the ambulance now. Anyway, the ambulance took me and drove me to the hospital 7 minutes from my house, and the bill came back $900.
Oh, wow.
And that time was like 2 a.m. or something. There was no traffic. There was nothing. 7 minutes drive, $900. I'm still paying for that. I'm not done because I have split all my medical bills, $30 a month, this 100, this. So it's going to take me 20 years and I'm still not done. And about the private insurance for nurses. So therefore, if you choose not to be a staff nurse attached to one facility, sitting there and working, going to work every day over there, you choose to do travel nursing, where the money is, where people are making $10,000 a week. People are making $7,000. That was COVID price, though it's come down a little bit. People are making $7,000 a week. That's what people see on the internet and think Priscilla is making $10,000 a week. If I'm making $10,000 a week, you wouldn't even see me. I'll be flying all over the world. That's just by the way. So most of the travel nursing agencies don't give you insurance. So you have to go and buy your private insurance. Some of them give, but most of them don't. So if you're a travel nurse, you are not committed to one facility. You are roaming. You do 12 weeks assignments in California. You do 12 weeks assignments in Ohio. You do 12 weeks assignments in North Dakota. You are moving, or you can even do it around your neighborhood and all, but you are an agency nurse. So you have to buy your own private insurance. But if you're making $10,000 a week, $7,000 a week, what is private insurance that you cannot afford? You can buy whatever you want with it. Yes. So please, we can go to the next topic.
Yeah, so I think basically maybe the last thing we could talk about is like accommodation or cost of living. So cost of living in the UK depends on where you are. We all know these days cost of living has gone up everywhere, not only here, everywhere in the world anyway. So it depends on your own, what you need. If you go buying too many unnecessary things, then it's on you, I would say. Housing as well, if you want to rent a place, it depends on which area. Some areas are expensive, others are a bit, moderate, and some are quite not so cheap, but manageable. And it depends whether you've gone for a 1-bedroom flat or you've gone for a 2-bed, 3 or 4-bed. It depends on whether you are getting a house in London or outside of London. So where I live, I would say I live in a 3-bedroom house. It's a mortgage, and we pay almost about £1,000 a month.
Wow.
Yeah, just about. It's under 1,000. Let's say 900 and something a month for this house. Hopefully in the next few years, we will finish paying, and I hope not to pay mortgage again. If you're renting a 2 and a 1-bedroom flat, sometimes you'll be surprised they might be almost the same. So it depends on the area once again as well, and which city you are renting. In some cities, you can be paying about between £500, £700 or £800 for a 2-bedroom, and you can be paying similar for a 3-bed in somewhere else. If you're in London, you can be paying about 1,000, between 800 and 1,000 something for a 2-bedroom. So it all depends on where you are living. And then you have to talk about petrol, your drive from home to work, and you have to pay road tax, you have to pay all the insurance. And so at the end of the month, you're spending on accommodation, you're spending on food and everything, and your gas bill. And in the UK as well, we pay something called council tax. So apart from your rent or your mortgage, they band each area or household. So we pay about 200 and something pounds a month for council tax. That is different from the mortgage. And this council tax is used for the bin collection and other things in the communities as well. So those are the other bills. And then you have your gas bill, you've got your electricity bill, if you have a car, you've got your car insurance, you have your home insurance if you're a homeowner, and the list goes on and on and on. So at the end, you end up spending almost all your money goes back in the system. And if you're not careful, you can't save anything.
Yes. So it's not too different from what you just said. We also live in a 3-bedroom house. It's a mortgage. The mortgage is normally 30 years. You have to pay it off. And I'm lucky. My husband is paying. So, and he's been paying for some years. He still has a long way to go. But yes. So for a 3-bedroom, everything is based on your location. Yes. I'm in New York State. I'm telling you, but I'm not in New York City. So if you're getting a 3-bedroom in New York City, you should be budgeting for like $3 million house or something, But if you're outskirts, you're a little bit outskirts, far from all that. Between myself, where I am, to New York City is a 6-hour drive, and we are in the same state. Yes, it's actually almost like an hour and 45 minutes flight. Because when I touched down in JFK, New York City, I took a flight to where I live, so you can see the distance. And so if you are renting a 3-bedroom, so the mortgage for like where we live, it's about $900, everything, tax, property tax, whatever, all inclusive, about $900. And if you are renting a 3-bedroom house, and depending on location, you can get a 3-bedroom house between 1,000, you can even get 900, but not in a good neighborhood. Gangs and whatever. America has shooting issues every day, drug issues. It's a whole messed up system. We can't talk much about that today. So it's between 900 all the way to $1,500, $1,500 thereabouts. But if you want a good 3-bedroom in a good neighborhood, it can go as high as 2,500. It's a whole house with a yard, a porch, a deck, a basement, an attic, and all that stuff. Yes. And the bills. There are so many bills. Health insurance, car insurance, property insurance, gas and electric, your Wi-Fi, your camera watching our house, we pay for that monthly. You have city tax, you have tax you pay to the state. When you have federal tax, federal is the country, America. The state is New York State tax. You pay that before you pay the federal. You will have students loans if you schooled here. You have childcare if your kids are going to school and you're paying. You have telephone bills. You have all your bills linked out to Verizon or T-Mobile or whatever, and you are paying all that. I can't even, what else? So many bills. And the gas, the prices of the gas, the one you put in your car and drive, fuel or petrol has gone up so much. And food, grocery, oh my God, grocery is also like that, but it consumes a lot. So you have to decide, am I coming as an individual? Am I coming to US with a child? What is my family size? And what is your goal? People ask me, be frank with me, you're my friend, tell me, should I go to UK or US? My simple answer I always give to you is that if you want money, come to US. If you want a good social system, you want to stay home 1 year with your child, you want to have a good health insurance that you're paying less for or literally free, go to UK. So what is your goal in life? If you are young, single, free, you are 19 to 25, you're not married, no kids, nothing. You might want to come to US, work, save up the money, and when you start having kids, having a family, you might move over to UK. But if you are coming to the US, a family of 5, bear in mind the first 1 or 2 years, your partner, your wife will be home. If you're a male coming in, your wife will be home for the first year or 2 to take care of the kids and for you guys to figure the system out. Will you be able to support the entire family of 5?
Yeah.
The first year, one partner will not be working. Even if the nurse was the one who came in and you brought your husband, the first at least 6 months, the husband is trying to find a job and figure out what to do, and the income will be coming from one person. I have a family of 5, family of 5 in UK. She said her husband is not able to find a job in his field. So she is supporting the family and she's making 1,900 pounds for a family of 5. So she's very stranded and she wants to get out. It took her so long to even get accommodation in the UK. The husband was back, the family was back in Ghana. She took the lead to figure out things, and the landlord said they want to see their husband before they rent to her. And I never heard that before. America, nobody cares so far as you are paying the money. That is it. And one good thing about the rent is that unlike Ghana, where you pay 3 years advance, 2 years rent, no, the rent is monthly. The mortgage is also monthly. When you are renting, there's a security deposit. So if the rent is $1,000, you pay for the first month, you pay $2,000. They'll keep $1,000 as a security deposit, and then 1,000 counts for that month. So today is we are in June, so your June rent is 1,000, but they'll take 2,000 before you move in. So that in case you destroy anything, they'll hold that 1,000. But when you're moving out and the room is still in a good shape, they'll give back your 1,000 to you. So the rent is monthly, you pay as you go. Yes, and so you have to choose the location. If you have younger kids, are you going to live in a condo? Are you going to live in a skyscraper? Are you going to live in an apartment in New York City? You have kids, you want your kids to grow mentally, you want them to play in a garden, you want them to play in a yard. You're not going to stay on top of an apartment and they'll be screaming, and your neighbors downstairs will be telling you to hold your kids. You can't hold your kids, the kids are jumping. Yeah, so if you have a family, you want to go to the suburb where you have some quiet, some greenery, less traffic and all. I love where I live because it's very quiet, there's no traffic, there's not too much noise, it's at the suburb. But if you are about the city life, the nightlife, oh, go to California, Hollywood, go to whatever. So your goal in life will determine where we want you to go. You either go to UK or US. Any last words for us, Becky, before we round this up? This has been so
Yeah, basically, I think it depends on the individual, what they want for themselves. And one thing to bear in mind is when you come to UK, you can start from UK, you can always move to US if you want to. The same way you can start in the US, you can always move into the UK as well. So it's up to the individual. I hope these discussion and information would help them in making their own decision. The choice is always up to you as an individual, and you have been there for that long. I've also been here for that long, and it's our own little experience we are sharing to help people to make that decision. I hope it's helpful.
Yeah, it's very helpful. Thank you so much for coming onto my channel. If you haven't subscribed to Becky Setcher's channel, the link is down in the comment section. I'll put it there and I'll put it in the description box. Kindly subscribe and follow us on Instagram, follow us, share our videos with others. We're just doing this willingly to help people. Some of us did not have anybody to look up to when we're making these moves. But now people behind us are watching this and knowing what to do with their lives as nurses. And this video is even general. You don't need to be a nurse to know about the bills and the healthcare system and accommodation, whatever. You can be a non-nursing person, a non-healthcare person, but you want to go to UK or US. This will be good for you to watch. Thank you very much, Becky. My name is Priscilla Kuma. I'm a registered nurse and I'm in New York State and I come from Ghana. We all come from Ghana, but I believe we are all citizens of the world. We are in different countries now, American and British. So thank you very much, Becky. And I'll see you. Bye-bye.
Thanks, Priscilla. Bye.